And at this time, I also want to introduce our Secretary for Global Siddha Medicine and Research, Mrs. Sandamarai Prabhakar. She'll give update on the latest that's going on in our activities. With that, let me turn it over to Chanda.
Thank you, Anna. Good morning, all. We will welcome you for the second part of the Women's Health Siddha's meeting from GCSMR, that stands for Global Center for Siddha Medicine and Research. As Anna said, we have been having this integrated approach in both allopathy and Siddha, and been using this, having this health topic seminar every month on different topics. And last 2 months we have been having this women's health, as a lot of women are having problems with so many issues, and we would like to know what is the approach on both sides, like how we will be approached by the integrated medicine, like from allopathy and also from Siddha. And last time we had Dr. Sathyavathy and Dr. Mangair Karasi for this integrated Zoom call. We had a very good response. So we want this as a part 2, as there are a lot of spectrum to be covered on the women's health. So this webinar we'll be having every month, the last Sunday of every month. So you're free to join anytime. It's a free webinar, and all the recording and other information will be posted in our website. You can go easily and find out a lot of information in our website, Global Center for Siddha Medicine, gcsmr.org. There are so many information about our past Zoom calls and various topics. We also had a webinar on COVID and obesity and so many topics. If you have any topic specific, please let us know. We will be arranging for that kind of topics also. And we also been planning to conduct some health um, health like meeting, if possible, in Zoom on specific health topics. As we know, we are a non-profit, and we heavily depend on donations and sponsorship. So every meeting will be sponsored from by some doctors or sponsors. Last few meetings we had very good sponsors, so we are also looking for some sponsors for this meetings. With that, I don't want to waste time. So many others are also joining. We have been having attendees from all over the world, from Sri Lanka, India, Australia, London, and Europe, and so many countries. So we will be having in a different time zone. With that, I'm giving this call to next Shankari. She will be introducing the speakers for us today. Shankari, are you ready? Okay, thank you.
எல்லாருக்கும் வணக்கம் and welcome. And I'm sure, thank you, Mr. Sivasailam and Mrs. Sandamarai Prabhakar, for a good overview of the GCSMR. And we do monthly webinars, and we always have one or two Siddha doctors and allopathy doctors to understand both concepts of medicine, so that we can present to the community both aspects of medicine. And our goal is to promote integrative health. And we have two great speakers today, and each of speaker will speak on the given topic for 20 minutes. And after the completion of the talk, we will have a question answer session. Since we have people are joining in from different parts of the world, we usually have these conferences in English. But உங்க question answer session அப்போ நீங்க உங்களுக்கு தமிழ்ல கேட்கணும்னா கேட்கலாம். One more request is that it's a general forum. So if you have any personal specific questions on your own health, we would recommend that you do not bring it up in this forum, and you can always have telehealth, telemedicine, or a specific individual consultation with the physician. And with that, let me go to the introduction of the speakers. It's a really great honor and pleasure to introduce my dear friend and such an accomplished person in our class is Professor Dr. Srikala Prasad. And she is currently the head of the Department of Urogynecology at Government KGH Hospital in Chennai. And our friendship started at 10th grade when I met her in high school at Adarsh Vidyalaya, and then we were also medical school classmates. She subsequently did her MD DGO at KMC and then pursued her MCH urology as one of the few female urogynecologists in Madras Medical College. And she has been very dedicated to her service in the hospital and also to the community. She also is currently a secretary of the Society of Vaginal Surgeons of India. She was a past secretary of Obstetrics and Gynecology Society of Southern India. Her passion is teaching. She also is very involved in community service, and she gives multiple lectures and conferences. And she has refined a lot of specific surgical techniques, and she also has come to the US even as just before the COVID in September for presenting in the International Gynecology Society. So, without taking too much time, it's a great pleasure, and I'm going to turn the microphone to Dr. Srikala Prasad.
Thank you, Shankari. Thank you for the nice words of introduction. My sincere thanks to Shankari, to Srikala, and the entire team of the GCSMR for doing this wonderful program. So without wasting much time, I think we will go on to our share screen.
I made you host so you can share your screen and start on that.
Is my screen visible now?
No, we still see your photo, so yeah.
Is it visible now?
Now what you can do is give me back the host. I will play the video from, I mean the PowerPoint from here. So.
I think I'm not. Am I audible now?
Yes, you are
but
audible.
My screen is not seen, no?
Yeah.
I will just try it. I think
okay.
It's now.
Yes, now we can see it. Now, okay.
Okay. Now, at the first thing, because the entire world is now struggling with this mixopathy, I just wanted to make it very clear. We are all a scientific society. The Siddha doctors are going to talk about their specialty, and allopathy doctors are going to talk about their doc. So there is no mixopathy, and we are not for that at all. So we are going to talk each on their own subject and specialization. So this obstetric care The A to Z of pregnancy is, more than a 3-year topic. So just to bring it short and concise, I have brought it like this. So when we see a pre-pregnant, one who's just married and wants a pre-pregnancy counseling, most of them ask us what is the ideal time to get married. The educated and working class only asks for this. Other than that, they easily get married soon. For the working class, we tell them the best time is within 20 to 30, and after they get married, because we see a lot of women with polycystic ovarian disease. So we generally don't unnecessarily ask them to postpone their pregnancy. But if they want to postpone their pregnancy, then we scientifically give them advice as to how to postpone their pregnancy. And we like them to take the vitamins, especially the folic acid. Intake of folic acid of at least 5 milligram per day goes a lot in improving and preventing those neural tube defects, as well as improving the hemoglobin of the patient. And we advise women when they are pregnant to avoid taking unnecessary drugs and unnecessary x-rays. But at the same time, we see a lot of women when they get married, they sort of they are worried about their family, the new family, so much so that they hide that they take the hypertension, diabetes medication, thyroid, and epilepsy drugs. So these gets us into a lot of problem, that the women throws convulsions and we are worried whether it is epilepsy, or in a patient who also has edema, we have to think of the possibility of an eclampsia also. So we encourage women to have good health around the time of conception. We want the diabetes, hypertension, hypothyroidism, any renal failure, epilepsy, or any medical disorders to be optimized, and review of medications, and if necessary, we modify it so that they are very safe for pregnancy. And then we encourage women not to have an unplanned pregnancy and teach them proper contraception. And what are the preconceptional? We would like to, many are obese nowadays. We give them diet to optimize the BMI. Simple measures like not skipping breakfast, liberal intake of fresh vegetables and fruits, talk about dietary protein, adequate intake of water, calorie and fat restriction. And also women, we let them know about their immunization status, and if not immunized against rubella, they have taken MMR, they seem to be rubella immunized, otherwise we take care. And if it is a period of stress, we also double up as a role and help them with the de-stressing. And genetic counseling is given only for women who have had previous problem, like with genetic disorder or any Down syndrome, etc. So overall, the antenatal care monitors the health of the mother as well as the health and the development of the baby. And we want to bring early detection. We want to detect the complication of pregnancy as soon as it is possible with the very vigilant antenatal care. Here, the majority of the problems mainly are anemia, diabetes, and preeclampsia. This is very often because we are able to go through it, prevent it because of a vigorous, dedicated antenatal health care by the healthcare providers. So as usual, history taking is common, we know, but for time constraints, I'm skipping. A little bit of nausea and vomiting, we are not worried. But at the same time, patient who has severe vomiting and dehydration, that patient needs to be taken care of. Heartburn, we do give them dietary advice, and if necessary, we can give them antacids. Similarly, constipation, increased frequency of micturition rod, we are not worried. But a patient with fever, palpitation, tiredness, breathlessness, and rest. A pregnant woman can have some amount of breathlessness, but if she is breathless at rest itself, that means there's something wrong. And swelling of body, again, we are worried. Severe headache, burning micturition, and of course vaginal bleeding. A pregnant woman is not supposed to have any bleeding at all, so any vaginal bleeding, we are worried and we need to take care. So when we go for a checkup, we know that not only we screen the mother, the basic investigations, we also ensure that we give them adequate folic acid from the first trimester. Not only from the first trimester, better to give them pre-pregnancy itself, iron and folic acid. And iron and folic acid, depending on whether they are actually, it's a prophylactic dose or therapeutic. They're anemic, we give them double the dose. And at every visit, we examine them give a physical examination, abdominal examination, and whatever the necessary blood tests, and we give them adequate counseling on the rest, nutrition, balanced diet, etc. And also we talk to them about what are the risk factors, and uh, counseling for having a spacing or for sterilization, all must start in the early period itself. There is no problem. If you ask them on the day of cesarean, it will not be possible. So we have to talk to them in the initial period itself. So we not only educate the women, also on the family members, on the signs of labor and the danger signs of obstetric complications. Like, for example, no, she doesn't feel the baby movements, we're worried. And if a woman has pedal edema, high BP, again, I put a slide on that, headache, vomiting, etc. And what is the importance of seeking antenatal and postnatal care is all explained to them. Advice on diet, personal hygiene, and rest, etc. And we educate patients about the benefits of breastfeeding and promote family planning. And this is an important point, that if this birth is by a cesarean, we counsel them to have a gap of at least 3 years until the next pregnancy. But that doesn't mean the patient should have a termination of pregnancy to achieve this gap. So if they have a cesarean, we remind them and then see that they space it, and an unnecessary termination of pregnancy is not done. Especially many people advise them against sleeping in the afternoon. A nap of at least 1 to 2 hours in the afternoon is good. And most of them have constipation, probably because of the effect of progesterone, the smooth muscle relaxation. So you need to teach them about how to improve their diet with high fiber diet, laxatives, etc. Daily bathing. They're worried. I know women, they say if they wash their tummy, the something will go wrong with their baby. So you have to explain to them that the baby is well, God has provided layers of support and nothing happens, and they have to take bath and loose garments. Similarly, dental treatment, if it doesn't involve any radiation or major treatment, you can go ahead. And most important is care of the nipples. If the retracted nipple is taken care in the initial aspect itself, a gentle pulling, massaging, then it goes a long way in breastfeeding. Similarly, having sex is not a taboo, but in the initial few weeks, and especially if the patient has a history of a previous abortion, we try to avoid sex, and maybe in the last few weeks. Otherwise, it is not wrong. They can go ahead. And travel, we avoid jerky travel and long travel, etc. Air travel is contraindicated in high risk cases, especially after 32 weeks, etc. And the smoking, number of people who smoke are very, very less. But we still see people who smoke and drink. So they have to be taught. And this is a very nice period, because as that mother feeling will be there, that is a nice period for them to get rid of this habit. So we talk to them about food habits, iron, calcium rich, protein rich, etc. And folic acid, how we give 5 milligram. It's a very simple tablet given free of cost in the government, and even when purchased, it is very cheap. So, as a routine, we prefer to give it pre-pregnancy and is continued through pregnancy. Similarly, calcium is very, very important. At least twice daily, calcium is essential, and it has been found that intake of 1,000 to 1,300 milligram a day prevents preeclampsia, which is again a very, very dangerous high risk factor for pregnant women. So this is what I told you, a calcium intake.
1 second,
And
Srikala.
what we need to do is
Those were
identify the high risk mothers. Previous stillbirth, we see a lot of elderly grandparents telling, "What is this big deal? We all became pregnant and delivered." But it is a physiological process, but then we need to safeguard our women. So we need to identify the high risk mothers, like previous stillbirth, IUD, a woman who has had a manual removal of placenta, ectopic pregnancy, molar pregnancy, preeclampsia. Preeclampsia is the one which we are worried. Is a eclampsia and preeclampsia are one of the killer diseases in pregnant women. So we need to take care of them. Bleeding during pregnancy, especially antepartum hemorrhage with abruption or placenta previa, are all very high risk factors. an RH negative mother, a woman who is morbidly obese or who is malnourished, women with post-dated pregnancy or a previous cesarean, and again, women with heart disease. Now, we see a lot of women who, with very good cardiac care, surgery, etc., are able to come to the level of adulthood and they undergo they after they get married, they become pregnant and come for delivery. So we need to take care of them. The patients with cardiovascular disease, kidney disease, diabetes, liver disease, etc., must be taken care of. Similarly, severe anemia.
Dr. Srikala,
Yes,
it's too noisy. Sorry, Ma, it's too noisy.
I think, I think
In my room, there is nobody else.
Dr. Srikala,
There is
one
somebody
second.
in the participants is having their mic on.
Yeah, this whoever is on Suguna Venta is 1 second.
I get it. That's what he's trying to do. He's in it.
I think there's Suguna Vipa is a yellow line is shown.
Can you please, Srikala,
Suguna Vipa.
can you hold on 1 second? You have the host, can you please
Because the
mute
election
them?
is over. It's been over for over a month. The Supreme Court reconfirmed on
Can
Friday
you
night. It's over. Just to
give
see
the
about
host option to Sivasayanam?
But on the right, it is not over. On the right, it will never be over. And there are basically entire television supporting this notion is not going to be over. The president and output
Can you mute Suguna Venta?
and we've just heard from the president in an interview with Fox. There's some new
Suguna Venta, can you please
Just a
mute
minute. First, bring in Mark Elias. He is one of the top election law attorneys in the country. He has represented Democrats for many years, and right now he's the Republicans. Mark, thanks for coming on the program.
Dr. Srikala, நீங்க அட்மினுங்களா இப்போ?
Can you go down
நீங்க
the list?
அட்மின்னா நீங்க அவங்கள மியூட் பண்ணலாங்க.
Can you
ஆளுக்கு
mute
ஐடியா
Suguna
நீங்க மியூட்
Venta?
பண்ணுங்க போய் பார்ட்டிசிபென்ட் லிஸ்ட்ல போய்.
Look at the participant list, please.
I think there is some crosstalk or something.
He says we're going to keep going. He has local lawsuits that are
Somebody else has to take care of the muting responsibility. You know?
Thank you, Shanti. I think you are, Shri, please go ahead.
Yeah. So, for me, I was telling you that we need to know what are the warning signs in pregnancy. See, a little headache here and there, we are not worried. But a woman with BP, with hypertension, with PIH, if she complains of headache, then we are worried. Similarly, a person who has decreased perception of fetal movement is an alarming sign. Bleeding in pregnancy is an alarming sign. It needs to be taken care of. And draining is a matter of concern. Chest pain. Breathlessness is physiological, but if you are breathless at rest and if you feel the degree of breathlessness is more, then we need to evaluate. Nowadays, like when we were in college, when we were just starting our training, we were not doing ECG and echo for everybody. But now it has become a routine that we do ECG and echo for all our antenatal women, that we want to screen them and see if their cardiac system is normal. We do see an increase in the number of patients with cardiac disorders who come to us for pregnancy. And what is the worry is in India, people after marriage tend to hide their disease, whether it is hypertension, diabetes, cardiac problem, or epilepsy. They feel scared to tell their new family. And so we need to be very vigilant in history taking as well as examination so that we don't miss. Severe abdominal pain is again a risk factor, again a warning sign we need to take care. Dizziness or blurring of vision also is a risk factor. So the other, anybody, and the other one which I was saying, no, hemoglobin loss, hemoglobin of less than 7 gram. Even in Chennai, we are seeing a lot of patients with low hemoglobin because we see women being told that, don't take medicines, that they also attributed to vitamins. They don't take. Again, there are a lot of myths that say if you take iron, the baby can become dark. or the baby can become obese. So we have a lot of people who don't take iron tablets. And another thing is they are intolerant to the oral iron. And they have, see, I'm not against dietary intake of oral iron, not at all against. But many of them, they say that, yeah, I'm taking dates, I'm taking murungakira, my hemoglobin will become normal. But with the pre-existing anemia and the demand of pregnancy and with the hemodilution, the hemoglobin further drops. So it's very mandatory that we teach them to the importance of improving their hemoglobin. If the hemoglobin is on a normal level, at least it's okay. Those who are anemic really need to improve their hemoglobin. And anybody who has got a convulsions or loss of consciousness or decrease or absent movement, all of them are patients whom we really need to take care. And continuous severe abdominal pain, premature rupture of membrane, high BP, anybody with fever, foul smelling discharge before or after delivery, or membrane rupture, they sit at home. Again, here also they have an idea that if they come late, they will deliver normally or they will not be taken up for section. So they should not come late with after having ruptured membranes, they stay at home. So that also is abnormal. So the PIH I was telling you is a real killer disease. So we really emphasize them. So if a patient who has got pedal edema, her blood pressure is really monitored. So we are not able to admit all of them. We in government hospital we encourage them to admit so that we can easily monitor. But such of those who are not willing for admission, we teach them the warning signs of pregnancy-induced hypertension like headache, vomiting, vision disturbances, blurring of vision, decreased urine output, or an epigastric pain. These are all warning symptoms of, or we say imminent eclampsia. That is, at any time these patients may throw a fit. And the severity or the problem for the patient becomes more. So we need to really emphasize and talk to them. So I was talking about all these danger symptoms. And the next problem which we see more common in diabetes, in the initial period when we were training, it was not this high. But now we are seeing an increase in the number of diabetic patients. We know that India is a diabetic capital of the world and we have a very large number. Similarly, there is an increased proportion in the number of diabetic pregnant women also. So here we test them for pregnancy early, as early as pregnancy, as well as in the second trimester, and again during the third trimester. So this we can do with regular fasting or PP, or even we go with the DIPSI criteria, that is we do an oral glucose tolerance test at the first antenatal visit with 75 grams of glucose, irrespective of whether they have taken food or anything, and keep a cutoff as more than 140 milligram after 2 hours. And then again, if you're giving a 2 hour 75 gram glucose, the cutoff is fasting more than 92, 1 hour 180, and 2 hour 153. So it is not meaning that every patient where we detect, we start them off with insulin. We also teach them regarding the dietary role, exercise, and how they can split their meals and take, and how they can cut down on easily broken carbohydrates and take other diet like protein, vegetable intake, etc. Another point which I wanted to emphasize is the importance of ultrasound. Ultrasound is still a taboo in many people. So many people think that you must not do ultrasound early in the pregnancy. They have an idea that let 3 months be over. After completion of third month, we will do. That is wrong, because this early pregnancy goes a long way in confirming whether the pregnancy is single or it is multiple. And this can diagnose ectopic pregnancy, which is also not a rare one. And I will show you a picture of a cornual ectopic, where, if it ruptures, it's like a killer disease. It's almost near the end of the uterus, where it is highly vascular. You're able to see my screen, no? Hello?
Yes,
I'm audible?
you're audible, Shri. That we are able to see your screen, but not
Okay.
just the importance of ultrasound. We see the
Yeah.
slide.
1 minute, 1 minute.
We are not seeing the picture yet.
Okay. So ultrasound goes a very long way in saving the mother. For example, early pregnancy, I was talking, we localize the pregnancy into the uterus or whether it is in the tube. In the tube, early detection, we can try medical management like methotrexate, and if like corneal pregnancy, surgery is better. That is one. Second, and if the patient with pregnancy has bleeding, this also helps us to confirm whether it is a viable pregnancy or is it a missed abortion. And an NT scan, nuchal translucency at around 11 to 13 weeks, along with this triple screening, goes a very long way in diagnosing Down syndrome, which is a chromosomal disorder and is associated with mental retardation. And it's a very pathetic state to see those babies born. So if this is a high index, then we can go in for termination of pregnancy. The other markers which are done along with this test also helps in prediction of pregnancy-induced hypertension and growth retardation. The next scan, which is very important, is the anomaly scan, which is done world over around the 20 weeks. So that is the
Doctor, we
period
can't
where
see
you
your
can.
scan slide.
Yeah,
Doctor?
I will show. I will show. The anomaly scan at around 20 weeks, where we are able to diagnose the abnormalities as well as it is still within a time where we can abort them. And subsequent scans are growth scans, which also find out whether the baby is growing well, the liker is normal, as well as in growth retarded babies, we are able to do Doppler. Okay, now see here, I will show you. This is the uterus. This is the tube. This is the unruptured ectopic pregnancy. Okay, this can you see almost near the fimbrial end. So you see a large sac. Okay, next I'll show you. Now, this is the whole uterus. This is a patient whom I operated. So can you see an carnal pregnancy? I will move this. I will try to. Now, are you able to see my screen is low? Can you see the tube? And this is the end closer to the cornu of the pregnancy. So the highly vascular. So if this patient ruptures, then it goes in for a real, I will just check, bleeding. So it's very, very important that I'm okay. So it's very, very important that we do a correct diagnosis that it is inside the uterus and there is no problem. That is the early ultrasound. And I was talking about the Down syndrome at 11 to 13 weeks, where along with the blood test, if necessary, we can even do an amniocentesis. But now there are a lot of non-invasive tests also which are available, which helps in the diagnosis. Okay, so this is a Down syndrome. And can you see these open neural tube defects, spina bifida, meningomyelocele? Is my screen visible now?
Yes, it's visible.
Yes. And here you see an anencephaly baby. The vault of the skull is absent, the brain is exposed. You also have an exomphalus, the whole intestine lying outside. And this is a thanatotrophic dysplasia. You can see the lower extremities, dwarfism, and this is a mermaid syndrome where the upper limbs are normal, the lower limb, can you see, it is fused like a mermaid. So a very good ultrasound plays a very important role. So we all now know the objectives of antenatal care. So I'm just going to skip. So anomaly scan again at 20 weeks, we are able to really see the baby well. Also the fetal echocardiogram. What important point I would like to stress is, we know that there are a lot of risk factors we would identify them like a person who has had a previous postpartum hemorrhage, person with the antepartum bleeding in pregnancy, or she is a grand multi, or it's a multiple pregnancy, or is a polyhydramnios, or a woman with fibroid complicating pregnancy, placenta previa prolonged labor. We know that all these women are high risk factor. So even if you take the government lowest strata, that is the village health nurses, identifies these population and refers them to the tertiary care center or to a bigger hospital referral center where they are able to take care. But this is a slide which I like is any antenatal women can land up in problem. That's why, I put one atom bomb like that. Anybody can go in for a problem. We never know that which woman can go in for a postpartum hemorrhage, which woman can go in for an amniotic fluid embolism. But this is not to scare anybody. At least postpartum hemorrhage, if a woman is not anemic, she will be able to withstand the normal blood loss. So it is highly imperative that the women and her family sees that her hemoglobin is correct to normal. So this point I want, any women who gives birth can develop PPH. Anybody. Though we know the risk factors which I told, they are more prone, but anybody can go in for a PPH. This is also another slide which I like. Taj Mahal, we all rave about. But Mumtaz died of postpartum hemorrhage during her 14th childbirth. So neither do we want a woman to die of bleeding, nor do we want so many grand multi-para, para 14 delivery. So no more Taj Mahal, no more. We don't want a woman to die of a postpartum hemorrhage, at least the preventable causes. At least let us try our best to see that her hemoglobin level is normalized. Other possible complications like intrauterine death, rupture uterus, eclampsia, cardiac, renal problems, and a big baby delivering and having a complete perineal tear, problems associated with the cesarean, so many things. The list is endless. But what I can tell you is a good antenatal care, a good intrapartum care, and a good postnatal care will go a long way in saving the mother. And similarly, when we go to the postnatal period, we know that once the mother delivers, including the obstetric team, they tend to little relax. But it is very important that we take care of them. We not only the rest, like we know that the baby needs to be fed every 1.5 or to 2 hours. So in between time, we must see that the mother gets rest, and we must see that she has help. And exercises we start slowly when she is fit to do. Walking is an easy exercise, is not a big deal. Pregnant women and women who deliver, after they have, those women who are breastfeeding will require an additional 300 calories. And also very important is they need to take a good fluid intake, as well as they need to themselves take in a lot of milk, at least around 800 ml of milk, for them to sustain good lactation. And during the follow-up visits, we need to check whether they are completely all right. Another more very important thing is the postpartum blues, the severity of the pain, her sleep disturbances, the need to take care of the baby. And it's a different facet of life. They can have a transient depression in the first few days of life. But if this transient depression persists past 2 weeks or worsens, and patient still feels sad, hopeless, trouble caring for the baby, then it is a warning symptom. We need to take care of them. This can even go bad that they have suicidal thoughts and can actually harm the baby or themselves going to commit suicide. But these should be identified, given adequate support. At the same time, there are some patients who develop neurological complications like cerebral venous thrombosis who can present to us with headache, giddiness. So we need to identify them and take care of them. So during all the healthy postnatal visits, not only the diet, importance of rest, sleep, perineal care is very important, in that we teach them how to take care of the perineum, as well as look for any sphincteric injury where the patient passes motion without her control. that also has to be examined. Breast care, whether there is any inverted, retracted nipple, has to be seen even before pregnancy and has to be checked even during the puerperium period. And this is a very wonderful period to teach them about the birth spacing and family planning. And in this corona era, the personal hygiene, use of mask, hand washing, we don't need to reinforce. It's become our way of life, is a part of our life at all. And lactation, you know, sometimes I take more time in teaching the patient about lactation than my cesarean. I can finish my cesarean in 25 minutes, but lactation, teaching the baby how to hold and making the baby latch onto the breast, you know, seeing that the baby's nipple, the mouth is on the areola, not on the nipple, and how the baby should suck, teach the mother, and then how to burp, all these things. And it is better to give, not to give both the breasts at the same time, because the fore milk contains only water, main of water, and the more of protein and fat are in the hind milk. So we have to teach the mother to feed one side of the breast at least for 15 to 20 minutes, and then birth the baby and use the other breast for the next feeding. Because if she gives feeding on both the sides, the baby will get the fore milk only from the both the breasts and will not gain weight. So this we need to really take care. And many of them will be asking for drugs and other things. We have to emphasize that the moment the baby sucks at the nipple, it gets these impulses to the brain, and then it releases prolactin, and the baby is able to get good milk. So we have, and we also believe in teaching them good foods for lactation, the fish or garlic, all those which helps. But most important is a dedicated feeding helps in a good lactation. And contraception is what we call the cafeteria approach. We show them the different aspects and ask them to choose. The only thing is we need to tell that they should not go in for a unwanted pregnancy and a termination. It's better to space in the scientific way. Thank you. I think maybe we little went fast for want of time.
Oh, thank you,
Yes.
Srikala. Yeah, thank you very much.
Srikala, if you hover over my picture, you'll see the three dots. Can you give me back the control? Host control.
Thank you very much, Dr. Srikala. I think one of the, maybe we can, since we are, with the interest of time, I will proceed with the next speaker introduction. There was one question, like you will just go over your slides, and one of the participants would like you to talk about the calcium supplementation. And do you have that slide handy? You can post it if you do.
We will write it in the chat.
Okay, okay, thank you. If you can do it in the chat, they wanted some,
Yes.
your recommendations on calcium supplementation.
Sure.
Okay, thank you. So,
So I will stop sharing so that others can.
Yeah.
Thank you so much for an excellent and very informative talk.
1 second, Dr. Sankari. Srikala, if you hover over my picture, you'll see three dots, and in that you can give me back the host controls.
I did not understand.
No, you're the host right now, so you have to give me back the host controls.
How do I do that?
Okay, you see my picture?
I'm seeing you.
Okay, go over the picture and hover, you'll see three dots. And in the one of the dots is, you'll be able to. On the top right, you'll see three
Yes,
dots.
I'm able to see three dots. I will make host.
Yeah, make me host, basically.
Do you want to change the host to Sivasalam?
Yes.
I say yes.
Yes, got it.
Is that fine?
Thank you.
Yeah, thank you.
Super. A quick 101 on IT control. Okay, now going on to our next speaker. Welcome, Dr. Sathyavathy. And Dr. Sathyavathy is not new to GCSMR. She is now coming to do the part 2 of women's health. Dr. Sathyavathy completed her bachelor's in Government Siddha Medical College in Palayamkottai, Tirunelveli in 2010. Then she did her MD Siddha in 2013. And it was it's so nice to read your resume, and I learned a lot about you. She has worked with Dr. Michael Jairaj, the Siddha Clinic in Papanasam, and I'm sure you've listened to him on YouTube, and he talks about herbal gardening and clinical practices. So she's worked with him. She subsequently worked with the Health India Foundation, started by Dr. Devanayagam, who was very much for integrative medicine and teacher to a lot of our allopathic physicians, and also worked with Dr. Selva Shanmugam, who is now running the Health India Foundation. She worked as a research associate in Ramachandra Medical College with Dr. Tanikachalam, and followed by currently she's a medical officer in the Siddha Clinic in Peringalattur, Chennai. And right now she is actively involved in SIR in research. So she comes in with a wealth of knowledge of Siddha medicine, in particular with women's health. And I'm extremely pleased to welcome you back for part 2 of women's health. Now, Dr. Sathyavathy.
Okay, the second slide, please. Good evening, all. Is my voice audible to everyone?
If you can be a
Doctor,
little bit louder, it'll be good.
Okay. Now is it audible, sir?
Yes, please proceed.
Okay. Okay. Good evening to all. Today, I would like to present the basics on the healthy pregnancy and childbirth in the aspect of Siddha for people. Next slide, please. Okay, as discussed in the previous Zoom meeting in the Women's Health of Part 1, already we spoke about the MEIMA code particle. I'm reminding it once again. MEIMum, it is the basic principle, or it is a basic principle on which the physiology of a human being works. And here, adhering to the topic of the women's health, Siddha system of medicine speaks about four types of sudugal. That means Udarchudu, Megachudu, Mulachudu, Garbachudu, and then the Sudagavayu and Garbavayu. Sudu, it in Siddha, it minimum, it doesn't mean only the heat. It refers to various pathological conditions and the physiological alterations in the and imbalance in the homeostasis of the body. Listening and speaking about the Udar Suda, it implies the heat, increased heat of the body, increased heat of the eyes, like that. Mega Suda, speaking about Mega Suda, it speaks about the white discharge of the genitourinary infections, ulcers in the bad order of the mouth, stomach ulcers. It speaks about, Mega Suda speaks about all these things. Coming to Mulachudu, it speaks about the piles and the constipation, the flatulence in the stomach, and overall thing like that. Garbhasudu, it speaks about the heat and the homeostasis and the physiology, which is related to the pregnancy. And any alterations in this sudu uh, results in Sudagavayu and Garbhavayu, thereby resulting in diseases. All the modern terms, or this is the terms, pathological terms, where the modification of this basics of the Meima code particle. Second, next slide, please. Okay, to correct the Meima code particle of the women, to correct the Meima code particle of the physiology of the women's health, and to bring back everything to the normal. So the system of medicine speaks about three things: oil bath twice a week, and simple purgations thrice a year, and then exercise and yogasanas daily. This oil bath and simple purgations we have already discussed in the previous meeting. Once again, I'm reminding it to you, this oil bath and the simple purgations results in the balance of the balancing the odor, shoda, and the vayu. The Siddha system of medicine speaks about மிகினும் குறையினும் நோய் செய்யும் நூலோர் வழி முதலாய் எண்ணிய மூன்று. This vali, aral, and ayam are related to this sood and this vayu. Thereby, the oil bath and the simple percussions results in balancing the Meima Kodpadagal of the women's health. And the daily routines, apart from all the daily routines, exercise and the yoga asanas, breathing exercises will help you to maintain the Meima Kodpadagal. Maintaining these routines will help in maintaining the homeostasis of the body, thereby uh, giving you perfect women health. Coming to the healthy pregnancy and childbirth, it does not come to it comes to the part only when they get married or when they plan for pregnancy. But what you reap is what you sow. So all the routines of the women's health mentioned before in the before slides should be followed from right from the birth. Oil bath or simple purgations and daily yogasanas or exercises, it should be followed like how we brush daily, how we bath daily, how we eat daily. All these routines should be followed so that only every woman can have a healthy pregnancy and a childbirth. Next slide. Next slide, sir. Okay, as already said, in the before meeting itself, we have discussed about the foods and the foods and the utensils magic to which supports the healthy pregnancy and childbirth. And reminding you once again, instead of using only rice and wheat, you can go for navadaniam, and you can avoid tamarind and instead take kodambuli. It is called as Garcinia indica or Garcinia gambogica. Avoid white sugar and go for palm jaggery. And using other oils can be avoided, and mostly gingerly oil and castor oil can be used for cooking. Castor oil to cook all the dals is more important. Only while you cook for idli or something, you can grind castor seeds oil on grinding itself. Or while you cook for dal and all, you can add a spoon of castor oil. And the use of Tiridoda Samana Purukal. What are all the products in the Anjare Patti like pepper, siragam, omam? All these things are called as a Tiridoda Samana Purukal, which in turn means the balance in the humus, Vadi Adal Ayam, the basic principles of this is the system. And coming to the women's health for a healthy pregnancy, when you plan for a pregnancy or when you in the adolescent period, the foods should be followed uh, are the red rice flour puttu with pachapairu, banana and ghee, the raw rice kolkatai with sweet moong dal, ulindanchoru or vandaya kanji, and the magic of three fruits, dates, figs, and pomegranate, which are mainly focuses on improving the hemoglobin content of the body, and they were relieving all the molecular and um giving you a perfect health. And the cooking utensils can be used like a mud pot, iron pan, and water storage using copper pot. All these utensils magics will give you the micronutrients available through the cooking itself. And ஒரு பானை சோறுக்கு ஒரு சோறு பதம் மாதிரி the utensils you use for cooking and we use for taking food, mixing everything, cooking all gives the micronutrients to the body. And the magical plant parts like moringa leaves, velpushani, valaipu, perandai, all these food items supports the women's health. And the importance of the three seeds, sesame seeds, yellow, on the first 5 days of the menstrual cycle, and the urad dal on 6th to 14th day of the menstrual cycle, and the fenugreek seeds with like Vandaya Kanji or Vandaya Kali from the 15th day to the 28th days. All these three seeds used as food during these menstrual cycle in a pattern mentioned here supports the hormones of your body to work in a correct proportion and balances your Meima code particle. Hence, it supports the women's health. Next slide, please. Okay, coming to the exercises of the asanas. Exercises you can go for 15 to 20 minutes of warm up exercises. Other than exercises, you can go for asanas. Asanam for menstrual disorders, you can go for Sarvangasanam, Pavalamuktasanam, Dhanurasanam, Janusirasasanam, Halasanam, Paschimothasanam. And in case of pregnancy, if you're newly trying asanas, you can go for pranayama, Mucha Payachhi, Konasana. It is nothing but the cobbler's pose with butterfly exercises, and Vajrasanam and Virasanam. Speaking about the Baddha Konasana, like the cobbler's pose, it reduces the when you do this asana throughout the pregnancy period, you can avoid the appearances of the resulting in the varicose vein after delivery. There would be some varicose vein problems also that can be avoided, and it helps the perineal muscles to loosen down and give a normal delivery. Asanas play an important role because they have certain sitting procedures along with the pranan, that is muche. It helps in healthy pregnancy and childbirth. Next one, please. Okay. As we discussed in the previous women's health meet, for normal menstrual cycle, we cooked the jam, katrale, kumari pakkuvam. Along with the kumari pakkuvam, kalyana murungai, this erythrina indica leaf powder, 5 to 10 grams twice a day with honey, or along with the food, helps in a regular menstrual cycle and helps to keep your uterus healthy. The second thing you can go for home remedy is a kalachi seed powder, 100-gram powder mixed with 10 grams of melagu. Both are mixed well, and you can take 5 grams twice a day with honey or a half-boiled egg. The third home remedy you can go for is kumari pakkuvam, as we already discussed. Aloe vera gel, 7 times washed freshly in freshly obtained water, washing aloe vera gel 100 grams, and then to it grounded palm jaggery, garlic paste, fenugreek seeds are mixed well, and they are cooked till it becomes a jam. All these three medicines are the home remedies for maintaining a healthy uterus and to regulate your menstrual cycle. These are home remedies. You can use it uh, at any cost for 1 month to 3 months for a healthy menstrual cycle and for a healthy uterus. But in case of using these three medicines, one or two medicines, or these three medicines will help you to regulate the irregular menstruation, and it in Siddha, we call it a Sudaga Tadai, Sudaga Vayu, all these PCODs conditions, amenorrhea, the absence of menstruation, many irregular menstrual problems, irregular ovulation, PCOS, all these conditions is cured by these three initial home remedy medicines. Apart from taking these medicines, if you have any complications, you have to meet your doctor. Other medical conditions like hemorrhagic cyst in the ovary, or missed abortions, tubal block, or any TB uterus, the severe anemia, that is hemoglobin going beyond 4 grams or 5 grams, ectopic pregnancy, we refer the patient for allopathic intervention, since the emergency operative procedures are not available in Siddha. So for healthy menstruation at home, you can go for these three medicines. Coming to the pregnancy, Siddha system of medicine, in Siddha system of medicine, Agathir Garbhakol, the book Agathir Garbhakol discusses about the various types of maladugal, and maladu means infertility in the female, and the different causes for it and the medications for it. But here, focusing on the people's medicine, so the aspect in people's medicine, uh, I'm going to give you some small health remedies which you can prepare it in your home for a healthy pregnancy. Here we are going to discuss about some major difficulties in pregnancy and their home remedies. First one we are going to speak about is vomiting or the morning sickness, is hyperemesis gravitorum, that is the severe vomiting in the mornings during pregnancy. So to overcome it, three medicines can be used at your home to overcome it. First one is the ginger, dates, dry grapes, and ghee combo. You have to peel off your ginger and you have to grind it. With that, you have to add cut pieces of dates, dry grapes, and you have to cook it with you have to add required amount of ghee and fry it well till it becomes like a jam. You can have it like half to one spoon twice a day. Having that balances the biliousness which arouses during pregnancy, and it helps in overcoming the vomiting and along with the vomit. If a pregnant woman continuously goes for vomiting, there will be some stomach ulcers and GTI problems also. This food along with the ginger, dates, and dry grapes ghee combo helps in reducing the regurgitation or the burning sensations and the ulcers, and it will help to meet out the vomiting and give an instant energy to the pregnant women. And the second thing is the Madulai Manapagu, and the third one is Annapodi. Next slide, please. Speaking about Madulai Manapagu, it is nothing but Manapagi, it is nothing but preservative. Like we cook adirasam at homes. It remains good for many days because the best preservative used from the olden days is the palm jaggery syrup, that is pag. So we are going to cook manapag. That means it gives a good order. So it is manam pag. So manakum pag. We are going to cook it. For that you need a pomegranate juice 100 ml and palm jaggery 100 gram. You have to mix it well and you have to boil it. After the palm jaggery it is dissolved, you have to filter it and then again heat it. Again, it is heated until it becomes like a pagu or kambi padam. As we go for in simplified form, you can say when you go prepare gulab jamuns at home, you prepare that sugar syrup like until that kambi padam. Like that, this palm jaggery and pomegranate juice is cooked till it becomes like a kambi padam or pagu padam. Then it is cooled, allowed to cool and stored in a bottle. 5 to 10 ml of this manapagu with water is taken immediately after vomiting, or and it can be taken throughout the day when required. It gives an uh, instant energy to the body, and it also helps in retaining the general health of the pregnant women. And the third thing I didn't mention is this annapodi. Annapodi, it comprises of chukku, milagu, tipli, சீரகம், சோம்பு, கருஞ்சீரகம், ஓமம், பெருங்காயம், and இந்துப்பு, all each 10 grams mixed with கருவேப்பிலை 100 grams. All these ingredients has to be fried well. I repeat it once again. Annapodi, it comprises of chukku, மிளகு, திப்பிலி, சீரகம், சோம்பு, கருஞ்சீரகம், ஓமம், பெருங்காயம், இந்துப்பு, all each 10 grams. It has to be fried and powdered. Along with it, powder of fried karveplai 100 grams has to be mixed well. It is taken like a half spoon to one spoon along with the food thrice a day. This karveplai along with the ingredients, anapodi ingredients, gives good digestion. It heals the GIT tract and repeated vomiting. It balances the biliousness. It balances the pittam. It balances the liver enzymes and helps in good digestion, and thereby retaining the health of the GIT in the pregnant women. It also, since the karveplai is muraya leaves, is curry leaves are more in this. It helps in improving the hemoglobin of the pregnant women also. Secondly, we are speaking here. We are going to speak about anemia. Anemia, as already ma'am discussed, anemia is a major problem each every pregnant woman phases. When it goes beyond when the hemoglobin level is maintained at the rate of 11, 12 throughout the pregnancy, then it's no problem. When it goes beyond 10, 8, 6, 7, then there is a more need for medicines that has to be directed by the physician only. But in pregnancy, to meet out the demand of the hemoglobin, what are the food contents which can be taken as ginger, dates, and pomegranate. Um I'm sorry, I have written wrongly. Not ginger, figs, dates, and pomegranate combo juice is correct. And the next one is amla and beetroot. And the third most important thing is the spleen and the liver of the goat is the very good supplement of to increase the hemoglobin of the pregnant women. It can be taken daily as a food. But if there is any vomiting or if they don't like due to the mood swings in pregnancy, you can go for leg or chest bone soups of the goat. Apart from taking all these food items, if there is anemia, then the patient has to cooperate with the physician for medications. There are more medications in Siddha, like ayachandoram, annabedi chandoram, which has to be taken along with the advice of the Siddha physician. And third thing, speaking about the folic acid and the thyroxine need in the pregnancy, they play a vital role. Folic acid and thyroxine is very important throughout the pregnancy for a healthy fetal growth and development, and for the mother's health also. Agathir, as I said before, Agathir Garbhakol Nool speaks about the various uh, um, diseases in the pregnancy and their therapeutic medicines which can be used to uh, uh, back from it. Here, the Agathir Garbhakol Nool speaks about medicines. The 10 along that speaks about mainly about the medicines which should be taken on the 10 months of delivery. Each and every month, first from the starting from the pregnancy of the first month and the pregnancy till the 10th month, the Agathir Garbhakol Nool speaks about some types of Vairu, Ulaidal, or Ratham, Velipadadal, in the Madri. It speaks about many conditions throughout the each month of pregnancy, and it gets given the medications for that. In that, the lotus stem and tuber is mentioned in many of the medications and from the first to ninth month of pregnancy. Uh, Speaking about the lotus stem and tuber, I'm here mentioning it because it is a rich folic acid rich food. So it can be taken as a kudineer or a kashayam in your regular food. But although the sprouts, greens, vegetables, fruits, or liver or broccoli, wheatgrass, or there are many things to meet out the folic acid requirement. In pregnancy, the folic acid tablets recommended by the government is most important, and it should be taken along with the food items mentioned here because it is very important. And coming to about the thyroxine, the hypothyroid and hyperthyroidism problems throughout the pregnancy should be the patients who should, if they have any problem regarding the thyroid, they have to take medications as directed by the physician. Next slide, sir. Okay, the fourth thing we are going to speak here is about the backache problems in pregnancy. It is when there is a physiological problem of a backache due to the bearing a child. There are some simple medications we can go for, as like more normal, mild exercises and yogasanas. And the second thing we can prepare at home is mukutunai or aingutunai. Mukutanai means the mixing of three oils. Aingutanai, it means the mixing of the five oils. Mukutanai, instead it refers to gingerly oil, castor oil, and cow ghee, each 100 ml. It should be mixed well, and it is added with pepper, garlic, and siragam seeds, and it is heated. Boil. Have to mix them well and boil with these three ingredients. It can be externally applied over the back and the legs, and allowed it to sit for 10 to 20 minutes, and after that you can go for a hot bath, so that the back pain due to bearing a child, and the leg pain, the knee pain, and the foot pain can be relieved well. You can also go for Aingutanai. In Aingutanai, apart from castor oil and ginger oil, the Siddha text refers to neem seed oil, pungu seed oil, and ilupai ennai. All the five ingredients can be taken, each 100 ml, and again it should be mixed with the three doda samana porukal, namely the siragam, garlic and pepper, and it must be boiled well. After that you can store it in a bottle. It can also be applied externally over all the joints and the muscles, and you can go for a mild massage, and after that, after 20 minutes, you can go for a hot water bath. It relieves all your back pain and the joint and muscle pain, and gives you a uh, good and stress free sleep or activity. The next slide, please. Speaking about the cramps in the calf muscle, or mainly in the eighth and ninth month of pregnancy, is more common. Apart from taking all these iron and calcium supplements and food items, there will be cramps in pregnancy. During those conditions, the pregnant women should avoid cold weather, and you can go for fermentation by applying this mukuttunai or aingutunai over the calf muscles and the leg, and you can go for a hot water fermentation. Avoiding cold weather, if the weather is very cold, you can go for heated coconut oil. How to prepare this heated coconut oil is, you can boil the coconut oil with camphor, and you can use it for external application over the toes and palms, mainly during sleep, so that the internal body temperature will raise, and it can avoid cramps, uh, ending in cramps. And the first sixth thing is, the next thing we are going to discuss is about the edema and the UTA, urinary tract infection in pregnancy. To overcome the overall edema of the body, or the edema of the legs, and the urinary tract infections, more amount of water intake. That means at least 3 to 4 liters of water intake should be taken. And the next thing is liquid diet. Liquid diet here, I mean it in the sense, it is not an oatmeal or like that. You can go for a rice powder kanji along with pachapairu, juices without sugar, like that. And in Tamil Nadu, there is a practice of sarani wear, called as Burhavia diffusa roots, mixed with the rice powder and made into kanji. This is given for the pregnant women. We have been using it in our clinical practice. This sarani wear kanji is like a food supplement only. You can take it along, and when the fifth to ninth months of pregnancy, when you have a leg edema, it is just a food content, so it does not give any harm to you. It helps in reducing the leg edema and the urinary tract infections like burning, micturition, or any white discharge or something. After taking a lot of liquid diet, drinking a lot of water, or this taking the saranavir kanji, if you have any edema or UTI in pregnancy, you can go for a refined castor oil. In the previous meeting, we have discussed about preparing this refined castor oil. Okay, next please. Okay, weakness in pregnancy. Throughout, since the mother holds the baby and she has to give everything to the baby's growth and development, weakness in pregnancy is a common factor. To overcome this weakness, protein and a highly nutritious diet is very important. Mainly kanji varieties and like payasam varieties in between the meals, with good interval of meals, will greatly contribute to the health and in reducing the weakness of the body. The pregnant women can grow for more green leafy vegetables, spinach, fruits, vegetables, and to reduce the weakness, you can go out for a walk in a fresh air and do breathing exercises also. As we discussed earlier, we are to overcome the vomiting in pregnancy. We prepared manapagu, madulai manapagu. Here, to overcome the weakness in pregnancy and to gain energy, you can b- prepare this manapagu. This manapagu comprises of ginger juice, lemon juice, pomegranate juice, and narathi juice. Each 100 ml, it is mixed with a 400 gram of palm jaggery and mixed well, and it is heated. After the palm jaggery dissolves, you have to once again filter it out, and you have to again boil it till it becomes kambi padam or pag padam. After it has been cooled, it can be stored, and 5 to 10 ml of this manapagu mixed with the water can be taken whenever you feel whenever the pregnant woman feels low or feels very weak. It helps in improving the digestion. It helps in improving the mood swings. It helps in improving the digestion and gives an instant energy. Next slide, please. Okay, speaking about the gestational diabetes and hypertension has been nowadays it has been more common in pregnancy. In speaking about the diabetes, a well balanced diet with carbohydrate, protein, and fat in each meal should be taken care. Walking, exercises, and in Siddha system of medicine, we go for many medicines for. There are many medicines for the diabetes even in pregnancy, especially avarai kudineer, avarai kudineer churanam with made into kudineer along with ayachanduram prepared from navel juice. But all these things
இல்ல
has to be taken
நான் மெசேஜ் வந்து இல்ல
along with the all these medications should be taken with the advice of the physician only. And speaking about the hypertension, it might uh, when it goes very high, it results in fits in pregnancy, and it will lead to more complications. So salt restricted diet, walking, exercise can be done along with the interventions recommended by the physicians for the hypertension and eclampsia. The patient can go for plain adadode leaf powder taken twice a day, 5 to 10 grams twice a day, along with honey, can help in supporting the body system, and help in reducing the hypertension and eclampsia, thereby contributing to the healthy pregnancy. Next slide, please. Okay. For a normal delivery, apart from yoga, asanas, exercise, walking, Siddha system of medicine strictly adheres to Pavana Panjangula Thailam from the confirmation of the pregnancy till the time of delivery. This Pavana Panjangula Thailam has been mentioned in the Siddha text Therayar Thaila Varga Churukam. There the medicine refers like ஏழு கோட்டைக்குள் விட்டிருக்கும் உயிர் என்ற அரசனாகிய அந்த மாதிரி it refers to um, uh, enhancing the proper pregnancy, enhancing the good health of the fetus, enhancing the good development of the DNA, all the uh, things. And it also mentions about the வயிறு ஆப்படித்தால் போல் செய்கின்ற மலாவர்த்தவாதம். It means the constipation, all the piles and bleeding piles during the pregnancy, and garbhachudu, and it speaks about everything, every complication in the pregnancy. Pavana Panchangla Thailam has been given to all the pregnant women from the confirmation of the pregnancy till the delivery. The doses will be modified by the physician according to the months of the pregnancy. It can be taken in mild doses from the first to ninth month, and the doses can be increased at the end of the last 2 weeks of the pregnancy. The dose will be increased according to the fixation of the head and the changes in the abdomen scan. You can go for a refined castor oil, as we discussed in the earlier women's health part. You can cook an oil at home. It means this small seeded resinous communal seeds, that is castor oil, 100 ml, along with 7 times freshly washed aloe vera gel juice, 100 ml, with fermented rice water, neeragaram, 100 ml, and chopped small onions, 10. All these four ingredients can be mixed well and boiled till the chopped onions turn crispy brown. You can filter it and you can store it in a vessel. This Pavana Panjangla Thailam, you can take during your pregnancy period with a consultation with the Siddha physician. It is good for all the problems, and it is good for a healthy pregnancy, and it is good for the complications like um, and any reduced reduction in the amniotic fluid or excessive amniotic fluid if there's there, and any complications due to that, or any incompetency in the cervix. All these cases have been um, has been cured by giving this Pavana Panjangla Thailam. When you go for a refined, you can go for Pavana Panjagla Thailam along with the direction of the physician, or you can cook a refined castor oil. It is a very uh, minimal home remedy which you can use it in your pregnancy period for a healthy pregnancy and normal delivery. This oil, prepared oil, can be this castor oil, aloe vera juice, fermented rice water, chopped on small onions, mixed and obtained. This castor oil is can be taken at the bedtime. At the bedtime, 5 ml from the confirmation of the pregnancy, and 10 ml at the ninth month of pregnancy, and 10 to 15 ml once or twice a day, morning and night, at the last 5 days of pregnancy. Taking 10 to 15 ml once or twice in morning, and both at morning and night during the last 5 days of pregnancy will help in loosening the pelvic bones and the perineal muscles, and helps in easy delivery. It reduces, in our clinical practice we have seen many cases where the threshold the pregnancy, the delivery pain threshold and the pain interval has been reduced, and normal delivery has been achieved along with this, both the refined castor oil and the Pavana Panjangla Thailam. So we recommend non Pavana Panjangla Thailam, or we cooking a refined castor oil at home. Both these oils can help in bringing out a normal delivery. Next slide, please. Okay. After delivery, there are many exercises, yogasanas and walking. You can go for it. Mainly Siddha system of medicine, or and speaking in the platform of the people medicine, it recommends perugala sarakagal. Using that perugala sarakagal ingredients, you go for the people nowadays also they go for perugala kulambu, they go for perugala rasam, and severe diet restrictions has been given for so before slide, sir. Okay. Severe next slide, sir. Severe diet has been recommended for for the women who has delivered newly, and the moderate diet is recommended for the next 45 days. Perugala Sarkagal, even at the Nilgiri district, Tirunelveli district, Nagarkovil, Kanyakumari district, also in here in Chennai, in Broadway also, and each and at not only in the state of Tamil Nadu, various in various states, the people they go for country drug shop, Nattu Marundu Kadai, and they used to buy Perugala Sarkagal when a woman at their home got delivered. They used to buy all these things. It is a combination of 10 drugs, it is a combination of 15 drugs, sometimes it will be a combination of 20 drugs, sometimes it will be a combination of 25 drugs. All these drugs are mixed well, they are grounded, and it is and the people used to prepare a legium form in their homes, and they used to give that delivered women. Siddha system of medicine, many named preparations like Prasava Nadaikaya legium, or Saubhagya Sundi Legium. It can be taken after the delivery, from the fifth day of delivery till 1 year. It can be taken. Siddha system of medicine recommends these legium and perigala legium, perigala sarakugal like perigala kulambu, perigala rasam, all these saubhagya sundi and nadekaya legium are recommended after delivery from the fifth day of the delivery to the 16th to the 1 year. When you go for C-sections, the patients are recommended to take this legium and perigala charakugal from 16th day to 1 year. These medications and these food practices helped people, and nowadays also it is helping people to overcome the uh, when the to overcome all the flatulences, the Garbha Vayu after delivery. It helps in bringing back the uterus to the normal position. It helps in bringing back the uterus to the normal state after bleeding. Helps in bringing back the to heal the endometrium. It helps in clearing all the flatulence. It helps in maintaining the balance of the Garbha Chuda after delivery, and thereby it supports the uterus also. Not only the legume, it does not work at the intestinal level. It also helps in preparing the uterus for the next delivery also. uh, Before slide, sir. Previous slide, sir. Okay, Perugala Kulambu, after delivery, after delivery, for first day, 55th day of delivery, people used to go for Perugala Kulambu with mainly small ingredients with the Anjarapati drugs like Siragam, Milagu, coconut, Kottamalli, Manjal, Inji, Poondu, Perangayam, and Karanjirakam. These powdered product is mixed with onions in ginger oil with the brinjal. Without tamarind, you can go for a gravy kurambu for first to fifth day of after delivery. It helps in bringing back the uterus to the normal. Next slide, sir. Next slide, please. Okay. After delivery, there is a problem of when it becomes after delivery, there is a problem of piles, the rectal prolapse, all these things. Piles, they have some bleeding piles. There will be a pain in the anus or any burning sensation in the anus. For this, you can go for a dates, fits, and pomegranate juice combo. It helps in reducing the constipation. It helps in relieving the pain of the anus. It helps in relieving the moolachodu, thereby contributing to the healthy anus and defecation. The refined castor oil we prepared is it can be externally applied over the anus to bring back the ruptured blood vessels during the bleeding piles, and it can be also be taken internal, and it can be applied external also. Taking the refined castor oil like 5 to 10 ml every day night with along with the rasam or any kadukai kudineer, it helps in defecation, relieving the constipation and the pain, pain and itching sensation in the piles. It helps in relieving the anal pain, and it helps in a good it helps as a laxative also. It mainly this refined castor oil helps in reducing the moolachodu. So within 3 to 5 days of taking this refined castor oil as an internal medicine, the pregnant women that after delivery, the piles complications will be relieved. When they have a prolapse outside, when they have a pile mass outside after delivery, Tiribalai, that is Kadakai Nelikai powder 10 grams along with 50 milligrams of alum boiled decoction. It can be used as a sit bath. It helps in reducing the pain in the anus. It helps in reducing the pile mass outside. It also reduces the pain. Anus contraction and the relaxation exercises can be done when there is a prolapse at the rectum. Mild prolapse at the rectum can be relieved by this kayakarpa paichi like anus contraction relaxation exercises. It will be more helpful. Speaking about the best breastfeeding, the Mainly the after delivery, uh, the sucking reflex helps in the improving the breastfeeding. Baby's sucking reflex can help in breastfeeding. Other than this, the food particles like பூண்டு, garlic, பச்சைப்பயிறு, கருவாடு, சுறா புட்டு has been recommended in food to improve the breastfeeding. Also, a tuber named Tannir Vitankalang, Asparagus racemosus tubers. It is also called as Sadavari in Sanskrit. It is available in the country shops, Natamarndakadai. It can be chopped into pieces and added along with the rice powder, and it can be taken in the form of kanji to improve the breastfeeding. uh, Kalyana Murangai, that is called as Erythrina indica leaf powder, can be also taken along with the food to improve the breastfeeding. Um, as already ma'am said, to avoid the postpartum psychosis, that is after delivery, due to the lack of sleep, irregular pattern of intake of food, in utmost care to care the baby, the mother loses everything. So if there is any depression or any, if she develops any suicidal symptoms or any psychotic problems, to overcome all these things, um, uh, apart from the food, family support and care or must for the mother to overcome all these problems. In case of cold weathers, the mothers uh, get some cracks over the nipple to overcome the crabs over the nipple. That is, Siddha system of medicine mentions it as mulai kambu veranam அல்லது mulai kambu வெடிப்பு. To overcome it, the refined castor oil or castor oil can be applied over the cracked nipples to overcome that pain, and it also heals that cracks in the nipple, so that it helps in good breastfeeding and relieves the pain over there. Next slide, sir. Okay, speaking about the baby care, mother milk and warmth are the precious thing for a baby uh, to grow and to develop healthy. When there is a absence of a mother milk, you we usually mention we usually advise for refined ragi powder kanji. What I mean here is refined ragi powder is, it is not the plain ragi powder. People in practices of here in Tamil Nadu state, people used to soak this ragi seeds for 3 to 4 hours. After that, they used to grind it well, then they filter it, and the obtained the kelvaragu milk, kelvaragu pal, it is exposed to sun in a white plate, and when the water evaporates, the refined powder form of ragi is obtained. This refined ragi powder is prepared into kanji and given for babies even without mother milk. It is easily digestible, and it gives a good health for a baby. Rather than nothing else in the world can support a baby like a mother milk. But when there is a situation of not getting the mother milk, then this refined ragi powder is helpful. Apart from this ragi powder, arrowroot kanji, it is, and the next one is the odial maavu powder prepared from the padangilagu, will help in uh, giving a nutritious effect to the baby. And since the system of medicine recommends urai matirai or urai marundu, it can be given for the baby from the third day to the 16th day, third day of delivery or 16th day of delivery till 5 years. This urai marundu is designed in such a way, it helps in it helps in improving the immunity of the child. It helps in good digestion of mother's milk. It helps in treating diseases like so the system of medicine speaks about many diseases in children's like mandam, kanam, karapan. All these uh, complications can be uh, prevented by when while you use an urai marundu from child. from the third day of delivery or 16th day of delivery till 5 years, so that urai marandu, urai kaap, it helps in improving the digestion, it helps in improving the immunity, it helps a child to overcome from all the chest infections also. So urai marandu is a very good medicine. It has been recommended by Siddha physicians to all the babies. And the fourth thing I would like to say is here is I would like to share a coconut oil prepared from a coconut milk for skin care. And you can go for bath with the nalungu mavu other than using any soap powders or soaps. And and the medicines, small medicines which is helpful for baby care is omam, adimaduram, and vasambu. These three um, are the most important drugs which has to be in the home where a child is born. Speaking about omam, in Tamil there is a good saying, "Udari pillaiki omam dam gadi." They say like that. So omam is a very important thing. Fried omam with burnt vasambu powder decoction can be given in case of any flatulence or indigestion or diarrhea. Oma kashayam, or the distilled form of the omam water, is given to the children to reduce the flatulence and to improve the digestion, and it is given to the children's to reduce the diarrhea. um, the, and the next the raw drug you can use it at home for children is adi maduram. The Siddha system of medicine speaks about agakarana noigal and purakarana noigal. In that agakarana noigal, adimaduram is being recommended from right from the birth till 6 months to 1 year for a baby with chest infection or cold infection, or if the baby restricts to drink mother's milk, if there is any chest or cold respiratory illness, if there is an indigestion, or if there is a chicken pox, Adimaduram is a very safe drug to use. It can be used in a form of powder, like chittigai is mean less than 100 milligrams, 100 milligrams, 200 milligrams, according to the day of the child, according to the month of the child. Adimaduram is a very safe drug. And the third important drug is the burnt vasambu powder, not the vasambu direct powder. It is the vasambu burnt charcoal is only used. Acorus calamus burnt charcoal is used as medicine for children's. They mention it as பேர் சொல்லா மருந்து. They even don't say the name also. Vasambu, they don't spell the name also. This vasambu is heated directly in the fire, or they used to mix manjal powder mixed with velakannai is castor oil is applied over the vasambu, and it is burnt into charcoal. Otherwise it can be directly heated in the fire and made into charcoal. This charcoal powder is being given in terms in doses of a pinch, 1 pinch, 2 pinch, 3 pinch, according to the day of the baby or according to the month of the baby, for digestive problems, indigestion, and diarrhea. Siddha system of medicine speaks about many child diseases like mandam, kanai, many things. This is the root cause of everything. So the use of urai marandu, omam, vasambu powder, burnt vasambu powder, adimadanam um, uh, helps in giving a good baby care. These are not Omakulinir or Adimaduram or burnt vasambu powder. These are not medicines. These are only food items, mainly specifically mentioned in Siddha text for newborn babies also within 6 months also. All these medicines and food items will support for a good baby care. Next slide, sir. It is the time to, I think, it is the time to summarize and conclude. First thing, in the first women's health part one, we speak about kumari pakvam and the refined castor oil and the food items. We also reminded here today also, which helps in maintaining a healthy uterus and a healthy menstrual cycle, like kalyana muringai powder, colored sheep powder, and kumari pakkuvam. It helps in regulating all the மெய்ம கோட்பாடுகள் of the women's physiology, and helps in maintaining a regular menstrual cycle, a good ovulation, and good for pregnancy planning. Next thing is, in pregnancy, vomiting. Along for we heard vomiting. We talk in vomiting topic. We talked about madulai manapagu, annapudi, and that ginger jam paste. It helps in overcoming the vomiting and the complications of the vomiting also. Speaking about the anemia, we mentioned about various food items. Thyroid deficiency, it is up to the decision of the doctor. Folic acid, apart from the food items, more than tamari, tamari root or stem or any folic acid rich foods, folic acid tablet is very important as recommended by the government. Speaking about the diabetes and the hypertension, it should be strictly, the patient should strictly adhere to the doctor's advice during the pregnancy. And in diabetes, the patient can take Siddha medicines like Avarai Kudinir Churanam for diabetes, and Avarai Kudinir for diabetes, and hypertensive medicines are there are more hypertensive medicine. Along with those medicines, you can go for Adadodi leaf powder and this refined castor oil or Pavana Panjangla Thailam. So it will help in reducing the eclampsia, stages of eclampsia, and reducing the hypertension, and thereby supporting the healthy pregnancy. Speaking about the edema and UTI infections, we speak about Kasarane Verkanji and the intake of the refined castor oil. And the last one is the cramps. Apart from taking about the calcium supplements and supplements and the food products, even though there is a cramp, you can go for this camphor mixed with the coconut oil external application, and you can go for a fermentation also. Speaking about the backache problems in pregnancy, I inform you about the I informed you about the Mukuttanai and Ainguttanai uh, for a mild massage and a hot water bath. And speaking about the normal delivery, we discussed about taking the refined castor oil and Pavana Panjangla Thailam. It um, helps in a good pregnancy period, and helps in normal delivery, and a good health of the fetus. Speaking about the piles and prolapse after delivery, we speak about taking about the refined castor oil, that dates, pomegranate, and fig juice, and along with the tripalai and padikaram kashayam for sit bath, and anal contraction relaxation exercises to reduce it. And speaking about the pregnancy, breastfeeding after delivery, we shared about few things about the tannir vittan kilangu and the food products for improving the breastfeeding, along with the nipple care when they have nipple crack or ulcers, they go for castor oil. Speaking about the lastly about the baby care, உரை மருந்து, the mother's milk and mother's care, along with உரை மருந்து and country drugs, அந்திரிதோட சமண பொருட்கள் like omam, vasambu suttakari, adimaduram, plays a major role in taking care of the baby's health. Finally, lastly, I would like to thank Dr. Michael Jeraj for giving a platform to work in the people sector, to take Siddha to the people sector. I would like to thank Mr. and Mrs. Devanayagam for giving me a space to work in Health India Foundation to travel with that. And I would like to thank Dr. Selva Shanmugam for giving me this platform to share this day and time. And thank you. And finally, I would like to thank everyone in this meeting for your patient listening. Thank you.
Thank you to Dr. Sathyavathy. Thanks to the speakers. I know you are in Indian time and it's bedtime for you, but we are all awake in the middle of the day. And thanks for staying with us. I'm going to open the forum to questions. And yeah, we can, if you have a question, we'll unmute and you can ask the question. But before I open the forum, there was one topic, Dr. Srikala. Can you share the discussion about the calcium supplementation? I think some of them missed because of the external disturbance during your talk.
Dr. Shankari and Dr. Srikala, one minute. There is some announcement I would like to make. Whatever Dr. Sathyavathy told, we have our website. We have all the ingredients and the preparation methods in our website. It's called Global Siddha for Global Medicine and Global Center for Siddha Medicine.org. You can go under food as medicine option, and we have all the preparation methods for annapudi and all other main ingredients, that how we can prepare with available products here in US and others countries. Whatever we have available here, we can make with that. And most of the preparation are listed in our website. And also the video recording and of these meetings are available in our website too. You can go to the past events and upcoming events. You can see the flyers, and under each flyer we have the recordings of all these meetings. If you want to go for reference, you can do that too. Thank you.
Dr. Srikala, can you go ahead and say from the allopathic standpoint, what is the calcium recommendations during pregnancy?
Okay. So from the allopathic point of view, there are two things which I would like to say. One is the dietary calcium. Dietary calcium, we encourage women to take milk. The recommended daily allowance of milk which we allow pregnant women to take is around 800 ml. This can be split through the day and taken along with curd. And the dietary supplement of calcium which we allow them to take is the calcium carbonate, 500 milligrams. It's difficult for them to take more than 500 milligram per day at a time. So 500 milligram even twice a day along, and all the tablets now get supplemented with calcium, vitamin D3 also. So we have he's put the slide again for me. The regular tablets contain, if it's calcium carbonate, we have 500 milligram. Lactate comes as 300. We also have calcium citrate for people who are stone formers, where the calcium citrate has a solubility state and prevents stone formation. And now I was going on talking about preeclampsia, where there is, when we advise them to take more calcium, at least up to 1000 milligram, we have found that it reduces the incidence of preeclampsia. And this vitamin D supplementation also is very useful. Up to 1000 milligram of vitamin D can be supplemented. Dietary calcium in the form of milk.
Thank you, Dr. Srikala. Any other questions?
You can also post your questions in chat window.
Okay. Hi, this is Betsy. I hope you can hear me.
Yes, we can. Please.
Okay. Thank you, Dr. Satya. It was very encouraging. It was, it was a very homely and friendly presentation, and I really enjoyed it. Thank you. I have two questions. One is, when you're in a first trimester, are there any foods that you need to avoid? And the second question is, when you're of age 35 or over and you're pregnant for the first time, is there some suggestion or something that you need to specifically take care of?
First question I would like to answer. First question, you should avoid sesame seeds, papaya, and these two things you have to avoid in the diet specifically. But after 6 months of pregnancy, you can go for sesame seeds. In Sri Lanka, they used to take a yellu pag, the diet named yellu pag, where the sesame seed powder and urad dal powder is mixed with the palm jaggery syrup, and it is made into balls, and you can have it in small quantities, that is 5 grams to 10 grams, after 6th month of pregnancy. Second question, after I couldn't
Age 35
very
and older
properly.
pregnancy, age 35 and older.
Okay. Okay, sir. Age 35 and older pregnancy, when you plan for a pregnancy at the later ages, it is you can take a time of 6 months to go for the diets mentioned in the meeting and the slides. You can go for good exercises, and you can go for good asanas during pregnancy, when you go for a pregnancy plan. And during the first three, after 35, you mentioned it as when you plan for pregnancy after 35 years, you have to be very careful and strictly adhere to the restrictions of the doctor, advices given by the doctor, to avoid any complications. You have to be very careful, and you have to strictly advise to the doctor's advice.
And there's a question from the chat box. Um, I'll let Dr. Srikala answer first and then subsequently Dr. Satya. How late a woman can get pregnant?
uh, I told you the ideal age would be 20 to 30. But we now see women who become pregnant late, who get married late and become late because of their career orientation or any other reasons. So there is nothing wrong, but only thing, what are the precautions we need to take? I was talking that we have an increased incidence of diabetes and hypertension in pregnancy, and this becomes much more if it is late in pregnancy because the onset of essential hypertension, etc. That is one. Second, we are worried about the chromosomal abnormalities like Down syndrome. But if a woman really conceives after 40, we don't discourage them. We ensure that we do all the screening for the Down syndrome from starting from the, I told you, the 11 to 13 weeks. Along with the scan, we do the markers. And in case we are doubtful, the non-invasive testing goes a long way in helping us. But in case we are doubtful, we even go for amniocentesis. So I don't think beyond 40 is very advisable. 20 to 30 would be the best period, but beyond which, with adequate care, I think she should be able to achieve a good growth.
Thank you, Dr. Srikala. How about Dr. Sathyavathy from a Siddha standpoint?
Ma'am has been very experienced, so I go by her words.
Okay, good answer.
Because I had a very good opportunity to learn many things from ma'am's presentation. So it would be adhering to her words would be good, I think.
Good answer. Thank you, Dr. Sathyavathy. Any other questions from the audience?
I'm not sure I can ask thyroid related questions here. What is some I seen many women have a thyroid problem nowadays. What should I eat to prevent such thyroid problem?
Dr. Sathyavathy?
Yes, ma'am. To avoid thyroid problems, healthy routine in like exercises and yoga asanas is very important. From the age of 8 or 9, uh, it is it is good to go for yoga asanas to teach your women and home in the adolescent period itself. You can avoid all this by doing these asanas. You can avoid, and you can go for this instead of using plain salts, you can go for kallup. It will be helping you to avoid the thing. Otherwise, there is no specific food to uh, imbalance it. The As already discussed in the session, the food items and the asanas will help you in avoiding the thyroid problems. That like oil bath, simple purgations thrice a year, and exercise and asanas will contribute to uh, the healthy women's health and in preventing the thyroid problems.
Thank you.
Any other questions from the audience? Okay, and the Mrs. Chandamarai.
There is one more question, I think, in the chat window.
Oh, just now it came.
Okay.
What type of a diet would you recommend to prevent miscarriage from the audience?
Such diet to prevent miscarriage. It is if there is any complication, miscarriages arises, but there is no specific food item to prevent the miscarriage once it happens. As I'm repeating once again, the food and the food products mentioned in this session has to be taken right from the adolescent period, so all it will result in a healthy uterus, thereby preventing the miscarriage. நவடேஸ் இப்போலாம் பார்த்தோன்னா, அதாவது 3 மாதம் வரைக்கும் நீங்கள் வந்து பெட் ரெஸ்ட்டில் இருக்கணும், அந்த மாதிரிலாம் ப்ரெக்னென்ட் ஆகிட்டாலே வந்து மாடிப்படி இறங்கக்கூடாது, அந்த மாதிரிலாம் சில கண்டிஷன்ஸ் இருக்குது. ஆனால் இன்னுமே சில மலைப்பகுதிகளில் பார்த்தோம் அப்படின்னா, பெண்கள் வந்து மலைகள்லேயே வந்து ரொம்ப தூரம் பணிகளுக்காக, அவங்களோட அன்றாட பணிகளுக்காக கூலி வேலை பார்க்குறதுக்கு மலையெல்லாம் ஏறி இறங்கிட்டு இருக்காங்க ப்ரெக்னென்சி பீரியட்லேயும். ஸோ குட் ஃபுட், ஒரு நல்ல டயட், நல்ல ஒரு ரொட்டீன், நல்ல ஒரு எக்ஸசைஸ் அண்ட் நல்ல ஒரு ரொட்டீன் ஃபுட் ஹேபிட்ஸ் அண்ட் எக்ஸசைஸ் மட்டும்தான் வந்து ஒரு ஹெல்த்தி யூட்ரஸையும் ஒரு ஹெல்த்தி அட்மாஸ்பியரையும் உங்களுக்கு க்ரியேட் பண்ணி அதனால உங்களுக்கு ஹெல்த்தை அச்சீவ் பண்ண முடியுமே தவிர, திடீர்னு ஏதோ ஒரு பொருள் திடீர்னு இதை சாப்பிட்டா உங்களுக்கு மிஸ்கேரேஜ் ப்ரிவென்ட் பண்ண முடியும் அப்படின்னு நம்ம எதையுமே குறிப்பிட்டு சொல்ல முடியாது.
Dr. Srikala, what is this is an important discussion. Please, we'd like to hear.
Yes. See, if you analyze world over, 10 to 15% of pregnancies can end up in an abortion. And if you analyze those abortions, most of them were chromosomal abnormalities or an unhealthy conception. So we may really not be able to prevent that with diet. But the worry is, if the patients are abort by themselves, it's not an issue. When they ask us specifically what they want us not to take, we ask them to take all fruits, but in our community, they consider papaya as an abortifacient. There are some people, like for example, in Nepal and Bhutan, where they give papaya to pregnant women, and it has not been found to be an abortifacient. But in my practice, I would say avoid papaya. There are so many other fruits which are available. It is not that it is an abortifacient, but as it is, when there is a spontaneous risk of miscarriage, why do I give that papaya? And then they come and say, you only gave papaya, and then they got aborted. So there are a lot of other fruits. I encourage them to take locally available fruits, and that too seasonal fruits. Instead of going for, Washington apple, whatever local fruits available, you take. Our goyaka is really good enough. So many fruits we have, provided they are not diabetic. If they're diabetic, we tend to cut down on even the vaழைப்பழம், which has got a real high glycemic index. Otherwise, abortifacient papaya is not an abortifacient. I'm very clear about that. But when we advise them, no, I say, yeah, they ask me, shall I stop? I say, yeah, please. Why do we ask them to give? I got so many other fruits to supplement them. So that doesn't mean I say it is an abortifacient, just playing safe. And for thyroid, we prefer to give iodinated salt. That is one. And similarly, earlier we were asking them to avoid cabbage and cauliflower, thinking it has goitrogens. But now the endocrinologists say that there is no role. But if it is a hypothyroid patient, maybe if they ask me, I'll say, yeah, you cut out. Again, we've got so many vegetables, lots of greens, enough and more vegetables. So it doesn't matter. So maybe because subsequently, it is not only as even the patient gets into trouble when this abortion is one real, not only a medical problem, it's a very social problem. So even if I see, when I say I will ask them not to take pineapple or papaya, it is not that I approve that it is an abortifacient. It is just I play safe. Do you understand? Because we really don't know how an abortion happens. காக்கா உட்கார பணம் இந்த மாதிரி இது சாப்பிட்டு அதனாலதான் ஆச்சுன்னா then everybody gets into trouble. So I encourage them to eat all other fruits, though I again tell them there are many countries which give this and is not an abortifacient. So play safe.
Good.
I mean,
Thank you.
I find it better that's way.
Thank you. Any more questions?
I have a question for Dr. Sathyavathy. I know நம்ம ஊர்லலாம் அது ரொம்ப எல்லா குடும்பங்களையும் பண்றது இந்த உரம் மருந்து சொல்றது. அது வந்து டாக்டர் ஹவுஸா இருந்தாலும் சரி, அங்க வந்து நம்ம பாட்டி, அம்மா அப்படின்னு பரம்பரையா தலைமுறையா வர்றது இந்த உரம் மருந்து. அதை கொடுக்கலாமா வேண்டாமா எங்களை மாதிரி வெளிநாட்டுக்கு வந்ததுக்கு அப்புறம் அது ஒரு பெரிய டிபேட்லாம் இருந்து கூட நாங்க பார்த்திருக்கோம். அதை கண்டினியூ பண்ணியிருக்கோம். இந்த உரம் மருந்துல உள்ள கொடுக்கக்கூடிய பொருட்கள் என்னென்ன டாக்டர்? அது என்ன இங்க நிறைய பேருக்கு தெரியாம இருக்கலாம். இப்ப அடுத்த தலைமுறைக்கு அது விட்டு கூட போயிருக்கலாம். அது வந்து எங்களை மாதிரி வெளிநாடு வாழ் இந்தியர்களுக்கு அது அடுத்தது எங்களால கொண்டு கூட போக முடியாது. சோ அதை நீங்க கொஞ்சம் சொன்னீங்கன்னா அதை பத்தி ஒரு வெப்சைட் கூட நம்ம வெப்சைட்ல கூட போடலாம் ஒரு இன்ஃபர்மேஷன். என்னென்னு சொன்னீங்கன்னா
உங்களுக்கு மீட்டிங் முடிஞ்சதுக்கு அப்புறம் நான் இதுல வந்து உங்களுக்கு அப்டேட் பண்றேன் இந்த பவர் பாயிண்ட் பிரசன்டேஷனோட. இன்னைக்கு நீங்க வந்து இந்த கூகுள்ல வந்து உரை மருந்து பத்தின ரிசர்ச் ஆர்டிகல்ஸ்லாம் நிறைய இருக்கு. அதனால என்ன உங்களுக்கு பயன்பாடுகள் இருக்கு, அது வந்து ஒரு ஃபோக்லோர் ப்ராக்டிஸ் கிடையாது. அது நிச்சயமா குழந்தைகளோட இம்யூனிட்டி, டைஜஸ்டிவ் ப்ராப்ளம்ஸ், ரெஸ்பிரேட்டரி இல்னஸை வந்து எந்த அளவுக்கு குறைக்குது அப்படிங்கிற அதோட எஃபிகசியை வந்து சித்தா சிஸ்டம் ஆஃப் மெடிசன்லேருந்து ரிசர்ச் இன்ஸ்டியூட்லேருந்து ப்ரூவ் பண்ண நிறைய ரிசர்ச் பேப்பர்ஸ் வந்து உங்களுக்கு அந்த உரை மருந்து அப்படிங்கிற டாபிக்லேயே உங்களுக்கு கிடைக்குது. இதை நான் உங்களுக்கு அந்த உரை மருந்தோட அந்த கண்டென்ட்ஸோட இதை வந்து ரேஷியோவோட நான் உங்களுக்கு அப்டேட் பண்ணுறேன் வெப்சைட்டில்.
ரொம்ப நன்றிங்க டாக்டர்.
ஓகே.
I have a question. இங்க இப்போ வெஸ்ட்ல வந்து நேச்சுரல் சைல்ட் பர்த் இஸ் ரெக்கமெண்டட் quite a lot of young people வந்து they want to have a child birth at home அந்த மாதிரிலாம் சொல்றாங்க. I know if it's a of course they go and test make sure there is no complications. அது மாதிரி இந்தியால அது மாதிரி is there a movement like that and people want to have a natural child birth? Westla it's becoming a little bit popular than normal. So we're using like a housewife, not a midwife, I should say. So what is your opinion? ரெண்டு பேருமே ஆன்சர் பண்ணலாம்.
In government of Tamil Nadu, we have grassroots levels. Deliveries are 100% by trained people, but they need not be MBBS, they need not be a gynecologist. We have the village health nurses who are trained for deliveries. They are the ones who pick up the high risk, and once it is a high risk, they refer. But I told you, anybody can turn turtle anytime, but by and large it doesn't happen, and most of the deliveries are taking place in the by the sector health nurses and the village health nurses, and we have a hierarchy. From there it goes to the primary health center and then to the first referral unit or the CMONG centers and things like that. So they are doing a lot of things to try and promote a vaginal delivery, and in case that is not possible, again a safe place to undergo a section, a cesarean section, blood transfusion, transportation by this 108, and everything has really improved. So I think we are doing a great deal, but other things like water birth, all those are not coming up. That is maybe very in the high corporate setups that's being done, but otherwise there is a real we have a lot of audit for the cesareans, especially for the primary cesarean. There is an audit and you need to, it's being scrutinized and then done.
I
and
see
there are some midwifery led units itself in our country, especially I've seen in Hyderabad and all, where the unit chief is a midwife, is not a doctor, is not a gynecologist. So they also have produced equivalent results. They produce very good results, but maybe the only thing is they take in patients who are low risk. to be on the safer side. They take in the patients who go into the midwifery-led units are the ones without high risk. And they are trained to deliver with and without episiotomies.
There is one question from the audience. Is there, Dr. Anu Arun, is there a role for barley as a diuretic during pregnancy? Dr. Sathyavathy, Abraham Sriyo, you can add to the answer. Siddha irukkuda barley?
Barley arsi kanji, we usually recommend barley arsi kanji to reduce the edema, pedal edema. கால்ல வீக்கம் இருக்கும்போது barley arsi kanji குடுக்க சொல்றோம். It is effective. அதே மாதிரி amniotic fluid level கம்மியா இருக்கும் போதும் வாட்டர் கண்டென்ட் அதிகமா உள்ள ஃபுட் எடுத்துக்கோங்க, தண்ணி நிறைய குடிங்க அப்படின்னு சொல்லும் போதும் barley arsi kanji வந்து குடிக்க சொல்றோம். It is clinically it is very effective.
Dr. Sri?
For example, diuresis in patients with pedal edema, we are little worried. ஏன்னா அந்த பீடல் எடிமா இருக்க பேஷண்ட்ஸ்ல பிஐஹெச்சும் காமனா இருக்குது. அப்போ there is a lot of hemo concentration and vasospasm. So I would give diuretic only when there is a pulmonary edema. Otherwise, diuretics are not at all indicated in pulmonary in preeclampsia, because basically they have vasospasm, may have hemoconcentration. So we don't encourage diuresis in pregnancy-induced hypertension in the pedal edema because of pregnancy-induced hypertension.
Thank you.
What Tarani, what would you want to say? Would you prefer, she's been a leading anesthetist for maternity cases, and she's the one who sees the maximum
If it is a
number.
normal pregnancy for edema, maybe you can give barley water. But if it is PIH, it is not advisable. It is not advisable to give a diuretic, as Srikala said.
Thank you, Dr. Tarani.
When you can rule out PIH, then it will help. In a normal pregnancy without PIH. After ruling out PIH, you can give. Otherwise, it's not recommended.
Okay. I think we are coming to like 1 p.m. and I know the people in India have to, we have to let them go to bed. So are there any last minute closing comments from the GCSMR team?
Yeah, I really want to thank Dr. Srikala Prasad and Dr. Sathyavathy for taking the time. As you said, it's past almost midnight and in India, and then we appreciate it. And the meeting is being recorded, so we will post it on our website. And the third series is going to be there. And Dr. Sankari, you want to add anything on the date? And it's going to be in January, I believe. So.
Yes, yeah, the third series in women's health, I think most of us in the audience can relate to postmenopausal problems. We will post all the details. I think we are coming into the holiday season. So from GCSMR group, I want to thank everyone and be safe. And Inga, we have Christmas, Happy New Year, and Happy Pongal. So mostly Pongal eல்லாம் கழிஞ்சு அதுக்கப்புறம் வந்து we are hoping end of January we'll have our third women's health meet. And I thank you again. And I am so nice to see Dr. Mangai, who did part 1, join the group today. And thank you everyone, and please enjoy the rest of the Sunday. And you have to go to sleep to start your Monday morning work.
Dr. Mangai wants to say something. Yeah, go ahead, please.
No, I just wanted to thank. My meeting was very good, and especially the Siddha aspect is something really marvelous. All these years, though we are practicing gynecology right from 1970, but this aspect of Siddha is really very interesting. After listening to her talk, even on the first visit, I just went and started going through many aspects what she talked. They all make really good sense, but it is sad part that none of us were aware of it. At least now, with the effort of few people, it comes to light. Thank you very much for all the efforts what Mr. Sivasailam and my niece Sandha doing is really wonderful.
Thank you for your kind words.
Thank you all, and we will take leave. Thank you, everyone, and have a good day.
Okay.
Thank you all for joining. We will meet with the next month with another topic. We will see whether we have some more to cover for the women's health. We may have part 3, but we will have a discussion and keep you in touch. Thank you all for joining today.
Thank you. Wish you all a very happy Christmas, Merry Christmas, and a Happy New Year, and a happy Pongal, and hope the Corona leaves us and we are able to have a happy and a blessed and safe 2021.
Thank you.
Thank you.
Thank you.